Urinary incontinence is an involuntary contraction of the bladder or the detrusor muscle where there is loss of control of urine. You cannot talk about incontinence and don't talk about urge and overactive bladder, because those two are the main components of what we discuss when we talk about urinary incontinence. Women are more affected by urinary incontinence, and it's actually closer to maybe 2/3 to 1/3 in terms of the problems that women have. One, the anatomy. Two, the issues that women have that lend more to urinary incontinence. Childbirth trauma, hysterectomies, pelvic surgeries. Those are some of the common things. Later on in life, as women have these issues, then they begin to present with these problems. You get a lot of people, particularly the females, with urinary incontinence, not reporting it. They're not reporting it to their doctors. They're not reporting it to their families because they think, oh, it's just a consequence of aging, and it's going to happen anyway. It's inevitable. And if I tell my children, because I'm now older, I'm going to be relegated to the nursing home. So that's the second reason they won't want to do that. It becomes an issue that's been hidden, especially in older patients, because I think, oh, there's nothing that's going to be done. So I'm going to just use my pads, I'm going to hide it, I'm going to become a social recluse, and that's going to be with me. But we have to let patients know that there's nothing really to be embarrassed about. Why? Because there's help. And there's a lot of help, whether it's medication, whether it's a surgical procedure, but the help is available. These medications are tried in an effort to get the patient dry. They're also tried in an effort to get the patient who has an urgency to go to the bathroom, but who's dry, to postpone the urge or to give a longer lag time so that patient does not have to rush to get there. The medications are also used. Sometimes we find that these patients may have small bladders, or sometimes it's not a small bladder, it's just a bladder that contracts involuntarily at its own time. And so we like to buy the patient's time, and we find that medications sometimes will work. On the other hand, if you have stress urinary incontinence, this is not an issue that responds very well to medication. It responds extremely well to surgical procedures, and there are a number of surgical procedures that can be done to correct this issue.